Let's roll.
Hey everybody, this is Dr. Will, and today we're going to talk about the difference between Invisalign and real braces. What are the top 3 good and bad things about Invisalign? We're going to compare those to real braces, and by the end of this 10-minute, 15-minute video, you should have a good understanding of the differences between Invisalign and real brackets and wires, real braces, and which one is good for you, okay? If you like what you hear today, please subscribe to our channel. We would love for you to join us on our journey of not only talking about dentistry, but also talking about things in real life that give you vitality and health and make you feel good during the day. So join us on that journey. When we're talking about Invisalign versus brackets and wires, let's give you a little history on the subject. When people started moving their teeth with braces, it's kind of crazy to think about it, but how in the world are your bone and roots moving your teeth all around, right? It's kind of a weird thing. You would think everything in there is concrete and nothing can shift, but that's not really true. Someone at some point found out that you could use brackets and wires to move teeth, and I'm not sure who that person was. I don't remember that from dental school. But realistically, we found that out and we were able to now shift teeth into a more beautiful position, which is great. Then came along another more aesthetically beautiful way of moving teeth called Invisalign. And that started the clear aligners movement, where now you can still move your teeth, but you're going to use plastic to move your teeth instead of brackets and wires. The big difference there is it's more aesthetically pleasing when you're smiling, right? But there are some compromises, and that's what we're going to talk about today. So which one is best for you? Real brackets and wires or Invisalign? Let's talk about it. Let's first talk about the top 3 good things about Invisalign versus brackets and wires. The first good thing about Invisalign is that there aren't any brackets and wires, right? When you smile and you have Invisalign on your teeth, instead of having a ceramic or metal bracket bonded to your teeth with a wire across, you don't have to deal with that anymore, which is very aesthetically pleasing. Maybe you like the look of it. Maybe you want your teeth shifted into a better position and you want a better smile, but you don't want to have to deal with actually having what they would call brace face, right? You don't want to have to deal with having brackets and wires. You don't want to have that look. So Invisalign is really good for someone who wants their teeth to be straighter, who wants a better bite, who wants better and healthier gum tissue, but they don't want to have to deal with the brackets and wires look. That's where Invisalign comes in. And Invisalign can be a really great thing for someone who was concerned about how it would look, but still wants a better bite, a better smile, and a healthier smile as well. So one big point to mention is that when you get Invisalign, you don't have to have the brackets and wires. It is plastic that will slip over your teeth. And that plastic will move your teeth into the right position over a number of trays. Okay? And we'll talk more about that in a minute. So the first thing that we just talked about is there's no brackets and wires with Invisalign, but with traditional braces, obviously there is. The number 2 great thing about Invisalign is that you can take the trays out and brush and floss your teeth. Obviously, you can't do that with real braces when they're bonded to your teeth. So the only time that you get to floss your teeth again, unless you're one of those people that actually flosses when they have real braces, which 90% of people don't, you can't brush and floss your teeth really, really well until the dentist takes your brackets and wires off. With Invisalign, the great thing is that whenever you take your trays out to eat, now you can brush and floss your teeth really well, and you don't have to worry about trying to get your brushing and flossing around the brackets and wires. It's really hard to clean. So a lot of kids that are like 15 to 18 years old who get real brackets and wires, one thing you notice is that they're not taking good care of their teeth. They might get cavities easier. Their gum health might decrease, and their gum health might go down significantly during the time that they're in real braces, specifically because they can't brush and floss very well. And then the third thing that is really great about Invisalign is that it doesn't hurt your roots as easily. What I mean by this is if you wear real brackets and wires too long, there is a thing that might happen to you, which it doesn't happen often, but the longer you wear braces, it's more likely to happen to you. After looking at thousands and thousands of x-rays and dental CTs on our patients, what you see sometimes is where someone's tooth was, and you have the root there, so the tooth is connected to the root. And let's say, for example, that the root is this long. Now all of a sudden the root is this long, and then it's this long, and then it's this long. I've seen people that are in their 30s and 40s have really, really small roots that were resorbing and going away, that was literally ruining their teeth because they had real brackets and wires too long. Now, again, I don't want to scare you because that doesn't happen often. It's a rare occurrence, and it does require you to wear brackets and wires for really years and years and years. So the people we see this on might have been wearing braces for 3 years, 4 years, 5 years. But what we know is that Invisalign is much less likely to do this, almost impossible. Because when you're using brackets and wires to move your teeth instead of plastic, it just provides a different force that might cause your body to somehow react to your roots to eat them away. Well, that's kind of scary. So Invisalign is going to be a wonderful thing for you if you don't want to have real brackets and wires for aesthetic reasons. If you really want to make sure that you don't have any root problems long term. Also, if you want to make sure that you're brushing and flossing your teeth really well, then Invisalign is a great candidate for you because now, or you're a great candidate for Invisalign, I should say, because now you can brush and floss your teeth really well around the trays. So to review, the top 3 great things about Invisalign is number 1, it just looks better. Aesthetically, it's more pleasing when you're smiling and you're going out with your friends than having real brackets and wires, especially if you're over the age of 20, 30, 40, and you don't want to have the look of braces, then Invisalign may be a great option for you. So just aesthetically, it looks better. That's probably the number 1 thing about Invisalign that makes it so much better than any other treatment. Number 2 is that it's easier to keep your teeth clean. You can brush and floss easier than real brackets and wires. Obviously, if you have brackets and wires, real braces on your teeth, it's harder to floss, harder to keep your tooth and gum health during the duration of your treatment. That's where Invisalign shines. And then lastly, Invisalign can't hurt your roots as easily with something called root resorption, and that's something that traditionally only happens with braces if you wear braces long term, which is virtually non-existent with Invisalign. So that keeps your roots and your bone a little bit more healthy long term. You're just at less risk of that, okay? Now that we've talked about the top 3 good things about Invisalign, let's talk about the bad things. And these are things we want to be honest about. You need to know what you're up against, and if there's anything that you might not like about Invisalign, you need to know this on the front end. And we've seen patients that came in and was really excited about it. They were really excited about Invisalign, and then all of a sudden, once they got Invisalign, maybe our team did not manage expectations well for patients, and now they didn't like what they received. So let's talk about what that means so that you can make sure that Invisalign is right for you. So the number 1 bad thing about Invisalign is that you still may need something called buttons and IPR. Let's talk about what those 2 things are. You can imagine that on, let's say, this wall behind me, there's no rock climber in the entire world that can climb this wall because there's nothing to grab onto, right? Doesn't matter if you're the best in the world. And because there's nothing to grab onto, it can't work as a rock climbing wall. Why? That probably sounds like a really funny analogy. You're like, what in the world are you getting at, Dr. Will? In the same way, if you don't put anything on the front parts of the teeth, then the plastic can't grab onto the tooth and shift it into the right position. So if you see one of your friends, one of your buddies, maybe a family member that gets Invisalign, you might notice that the dentist has bonded some filling material on the front parts of their teeth so that now the plastic will pop on, grab onto the tooth, and then shift it in the right position. So without those buttons, your Invisalign case may take a lot longer, or it might even be impossible. If you want Invisalign to go in an efficient manner and not take too long, then it's very possible your case may need buttons. It's something that's very simple. They're tooth colored, you cannot easily see them, and they're just bonded to the fronts of your teeth during treatment, and then they're polished off at the end of treatment. But you still need to know that that's a possible thing, because some of our patients have come in, didn't realize that they were going to get buttons, and maybe we didn't communicate well with them, and then we learned our lesson, because our patients need to know that buttons are potentially a part of treatment if they want it to go efficiently and at a good speed. Now, can you do Invisalign without buttons? The answer is yes, you absolutely can do Invisalign without buttons. It just may take much longer. And depending on the complexity of your case, you may be a case where you can't do Invisalign with buttons. Another thing that we want to talk about is IPR. This is interproximal reduction. That is a fancy term for basically saying that if your teeth are overlapped and too crowded, and that's what you're trying to fix, then there's no way for your tooth to go through the other one, right? And so if we were to get them all lined up, that might make you two buck teeth. So to get them all lined up, you can either make them all flare out, which for some people might make your smile go way too out and look too flared. So what we can do is polish just a little bit in between your back teeth, which now makes a little bit of room. So now we can shift your teeth back and then get these lined up into the proper position. That is a very normal thing as well. So if you're somebody who does not want anything bonded on your teeth and you don't want any tooth polishing or tooth removal in between your teeth to make this possible, then it doesn't mean that Invisalign's impossible for you. It just might make it a lot more complicated. So you might want to ask your dentist about buttons and about IPR. If you want Invisalign, simply say, hey, do I need IPR or do I need buttons? That will help you understand with the dentist, do you need those things before you pay and before treatment so you can be prepared and your expectations can be matched. The number 2 bad thing about Invisalign is that you have to be way more responsible for Invisalign to work. And what I mean by that is, if you got real braces, then the great thing about it is it's just on your teeth. So whatever the dentist does to shift things around month by month, when you leave that dentist office, there's nothing that you can do that can really mess things up other than maybe eating raw carrots and popping the brackets off or not brushing your teeth as good as you can. Ultimately, the brackets are where the brackets are and the wires are where the wires are, and there's nothing you can do about it. But that may be a great thing. If you know you're not a very responsible person, it just is what it is, then I would consider real brackets and wires for you. You might be someone who would benefit big time from real braces because now you don't have to worry about taking your trays in and out. Funny enough, when I was 15, so we're talking 25 years ago, I was one of the first candidates of Invisalign. Invisalign had not been around long at all. It was a brand new thing at my orthodontist office. And I tried it at 15, and the amount of times where I lost my trays on my lunch tray while I was eating as a kid, it happened all the time. Because, you're an irresponsible 15-year-old. Well, now fast forward to being 30 or 40 or 50, however old you are, if you can be honest with yourself and you know that you're not going to be responsible to pop the tray out, keep it in your pocket, go and brush your teeth, pop the tray back in, and you're going to be more likely to lose that tray, then you're going to have to call the office and get a new tray, and that just might be a huge pain in the butt. So to prevent that from happening, what I would recommend is that you get real braces if you know that you're not the most responsible. The number 3 bad thing about Invisalign is that you still may get cavities because the trays can trap bad bacteria and the processed food that you may eat. And what we mean by that is when you take your tray out with Invisalign and then you go eat food, you really need to at least brush your teeth really quickly and then pop your tray back in. The Invisalign trays need to be worn 22 hours out of 24 hours. That means you don't have a lot of time. That also means that after you eat, whatever you eat, you really need to get the trays back in so they can continue to do the work. So if you're somebody that likes to eat a lot of processed food, or you like to drink a lot of red wine or Coke or anything with like coffee that's a dark liquid, the problem is all that stuff can get underneath the plastic tray. And not only does that look funny, like think about wine getting under your plastic tray and you smile and it's all red. It doesn't even make any sense. Like you just can't do it. So if you're somebody that knows that you eat a lot of processed food, you're cavity prone, you drink a lot of red wine and coffee maybe a lot of coffee throughout the day, or maybe a lot of red wine at night, then Invisalign might not be right for you because then you're going to trap all that stuff in the tray. Or maybe you don't even wear your trays because now you don't want to have to deal with all that stuff, and now you're not wearing Invisalign for the prescribed amount of time, which is 22 hours out of 24 hours. So if you're someone who likes to drink a lot of coffee or red wine, or if you're someone who eats a lot of processed food and you're cavity prone, real braces might be best for you because now you're not trapping anything underneath your plastic trays. Now, that doesn't say that you can't be more cavity prone with real braces. Obviously, it's harder to floss and it's harder to get the brush bristles around the brackets, so it can still be a problem there. But ultimately, if you are someone who is super cavity prone and you eat a lot of processed food, I would recommend not doing that. But if you are someone who's doing that, then Invisalign might not be right for you. So to review, the 3 potentially bad things about getting Invisalign for you is number 1, buttons and IPR. If you really don't want anything on your front teeth at all, or you don't want any of your teeth shaved down, then it might make your Invisalign case more complicated if you ask your dentist about, hey, do I need IPR? And do I need buttons? Okay, I do. I don't want any of those things. Now the case might be very complicated to complete with Invisalign, but it's still a very important thing to ask your dentist. Number 2, you need to be way more responsible than real braces. You have to keep up with your trays. Traditionally, you change these trays out every 2 weeks. Some dentists have you change them every 1 week, but ultimately, you have to keep up with these trays every 2 weeks before you move on to the next one. So being responsible is challenging sometimes. And then number 3, if you don't brush well, or you like coffee and teas and red wine, or you eat a lot of processed foods, then the Invisalign can trap those things underneath your braces and can cause problems. So those are the top 3 good and bad things about Invisalign. And I hope that it gave you some information that can help you make a decision. Are real braces best for you, or is Invisalign best for you? Well, that's up to you. And ultimately, your first step is going to be to have a consult with a dentist and ask them these questions about your case. How long is it going to be estimated? How long do I wear each tray? Do I need buttons and IPR? And how do I keep things clean if you're a big coffee drinker or wine drinker? Which one do they recommend, real braces or Invisalign? So thank you for watching. Again, I'm Dr. Will, and we will see you next time.